Colon cancer is one of the most common cancers worldwide, but the good news is it's also one of the most preventable, if caught early. Unfortunately, many people miss the warning signs, dismissing them as minor digestive issues. Knowing what to look for can make all the difference. Here are 8 warning signs of colon cancer you should never ignore. At number 8, persistent changes in bowel habits. Have you noticed a sudden and lasting change in your bowel movements? While occasional irregularity is normal, consistent changes like chronic diarrhea, constipation, or a noticeable shift in stool consistency, lasting more than a few weeks, could be an early warning sign of colon cancer. This happens because tumors in the colon can partially obstruct the passage of stool, disrupting your normal bowel habits. For example, you may experience constipation because stool has a harder time passing through the narrowed area of the colon, or diarrhea if the tumor causes irritation or inflammation in the digestive tract. According to the American Cancer Society, ongoing irregularities like these should not be ignored, as they may indicate a tumor growing in the colon. Pay close attention if these changes persist despite changes in diet or over-the-counter remedies, as they could signal something more serious than common digestive issues. In addition, you might notice changes in stool appearance, such as mucus or unusual color, which can also point to underlying problems. It's always better to consult a healthcare provider if you experience these symptoms for more than a few weeks, as early intervention can make a significant difference. Occasional stomach trouble is normal, but the next symptom on our list could be even more alarming and harder to ignore. Number 7. Blood in your stool. Seeing bright red or dark blood in your stool is a sign that should never be ignored. While it's true that rectal bleeding can be caused by less serious issues like hemorrhoids or anal fissures, persistent or unexplained bleeding could indicate something much more serious, such as colon cancer. Colon tumors often bleed as they grow, and this blood can either appear as bright red streaks on your stool, or make the stool appear dark and tarry, which suggests bleeding higher up in the colon. According to the National Cancer Institute, the bleeding may not always be visible to the naked eye, known as microscopic bleeding, but it can still lead to iron deficiency anemia over time, as the body loses blood gradually. The key here is persistence. Occasional bleeding after straining might not be alarming, but if it happens consistently or is accompanied by other symptoms like changes in bowel habits or abdominal pain, it's crucial to get checked by a healthcare provider. A fecal occult blood test, FOBT, or a colonoscopy can detect hidden blood and help diagnose the problem early. Speaking of anemia, there's another symptom that could point to hidden blood loss in your body. At number 6, unexplained fatigue and weakness. Are you feeling constantly tired and weak, even when you're getting enough rest? This type of persistent fatigue can be a silent warning sign of colon cancer. Slow internal bleeding caused by a tumor in the colon can lead to iron deficiency anemia, which is often one of the earliest indicators of a problem. Anemia means your body isn't producing enough healthy red blood cells to carry oxygen throughout your system, leaving you feeling drained, lightheaded, or even short of breath. According to the Mayo Clinic, additional symptoms of anemia caused by blood loss include pale skin, dizziness, and an increased heart rate as your body tries to compensate for the lack of oxygen. It's important to note that fatigue can result from many factors, like stress or poor sleep, but when it's persistent and coupled with other symptoms such as rectal bleeding or changes in bowel habits, it's time to take it seriously and consult a doctor. A blood test can help identify anemia and guide further diagnostic steps like a colonoscopy. Fatigue can have many causes, but when combined with this next symptom, it's a red flag you should never ignore. At number 5, unintentional weight loss. Are you losing weight without trying? While it might sound like a dream for some, sudden and unexplained weight loss can be a serious red flag. Colon cancer cells can interfere with the way your body processes energy, speeding up your metabolism and causing you to burn more calories than usual, even if your diet and exercise routine haven't changed. According to the American Gastroenterological Association, unexplained weight loss of 10 pounds or more in a short period is a symptom that should never be ignored. Tumors in the colon can also cause blockages, which affect digestion and lead to reduced nutrient absorption, another potential factor behind the sudden drop in weight. This type of weight loss often occurs alongside other symptoms, such as fatigue or changes in bowel habits, making it a key signal that something isn't right in your digestive system. If you're noticing a dramatic change in your weight without making lifestyle changes, it's important to consult a healthcare provider to rule out serious conditions like colon cancer. And, if weight loss and fatigue weren't concerning enough, the next symptom could point to something more serious happening inside your digestive tract. At number 4, persistent abdominal pain or cramping. We all experience mild bloating or stomach cramps from time to time, but ongoing abdominal pain or discomfort that doesn't go away could signal a more serious issue such as colon cancer. Tumors in the colon can partially block the digestive tract, leading to painful cramping, bloating, and a sense of fullness. According to a study published in the Journal of Gastrointestinal Oncology, persistent pain in the lower abdomen should never be ignored, especially if it's accompanied by other symptoms like changes in bowel habits, blood in your stool, or unintentional weight loss. The pain often results from the tumor disrupting normal bowel movement or causing inflammation in the surrounding tissues. This type of abdominal discomfort can range from mild to severe, and because it often builds gradually, people may dismiss it as gas, indigestion, or even stress. However, if the pain becomes chronic or worsens over time, it's important to seek medical attention. A doctor may recommend imaging tests or a colonoscopy to determine the root cause. But while occasional stomach aches are common, the next sign may be harder to spot. At number 3, feeling like you can't empty your bowels. Do you ever feel like you still need to go, even after using the bathroom? This persistent sensation, called tenesmus, is more than just an uncomfortable feeling. It could be an early warning sign of colon cancer. Tumors in the colon can partially block the digestive tract, preventing the bowel from emptying completely and creating a constant feeling of fullness or pressure. The Colorectal Cancer Alliance emphasizes that tenesmus is often overlooked because people dismiss it as a minor inconvenience or attribute it to common digestive issues like constipation or hemorrhoids. However, when this sensation becomes chronic or is paired with other symptoms, such as blood in the stool or abdominal cramping, it's critical to seek medical attention. This symptom can also cause frustration and discomfort, as no matter how many times you try to use the bathroom, you're left feeling unsatisfied. A healthcare provider can determine the cause through imaging tests, such as a colonoscopy, and rule out more serious conditions like colon cancer. The next warning sign is one of the most overlooked, yet it could signal something serious happening inside your digestive system. At number 2 we have narrow or thin stools. Have you noticed your stool suddenly becoming thin, pencil-like, or ribbon-shaped for an extended period? This could be caused by a narrowing of the colon, which often occurs when a tumor partially blocks the passage of waste. Tumors can reduce the diameter of the colon, forcing stools to take on a thinner shape as they pass through. According to the Cleveland Clinic, persistent changes in stool shape or size should always be investigated, especially if they last more than a few days, or are accompanied by other symptoms like abdominal pain, blood in the stool, or unexplained weight loss. While occasional changes in stool size can result from diet or minor digestive issues, consistent thin stools may indicate a more serious condition, such as a blockage caused by a tumor. Pay attention if this symptom persists, as early detection of colon cancer significantly increases the chances of successful treatment. And finally, we arrive at the most concerning symptom, the one you should never, ever ignore. At number 1, feeling like something is off in your body. Your body has a remarkable way of signaling when something isn't quite right. Many colon cancer patients report having a gut feeling, a persistent sense that something is wrong, even when the symptoms seem mild or vague. This may include a combination of subtle changes like fatigue, minor abdominal discomfort, unusual bowel habits, or a general feeling of unease. Often these early signs are easy to dismiss as stress, aging, or minor digestive issues. However, when they persist or worsen, it's crucial to listen to your body. Colon cancer is highly treatable when caught early, and those mild symptoms could be the first clues. A simple screening test, such as a colonoscopy, can identify precancerous polyps before they have a chance to turn into cancer. Early detection can make all the difference in treatment outcomes. Trust your instincts. If you feel something is off and it doesn't improve over time, it's always better to check with a healthcare provider. After all, catching colon cancer early could save your life. If you found this video helpful, don't forget to give it a thumbs up, hit subscribe, and share it with someone who needs to hear this information. Which of these signs surprised you the most? Have you or someone you know ever experienced colon cancer symptoms? Let us know in the comments below. Also, check out our merchandise and leave a super thanks if you'd like to support the channel. Thanks for watching. Stay informed, stay healthy, and we'll see you in the next video.